So how did you find your way into the specialty that you're in now, which is OCD?
Well, that was a personal life experience that changed things. My daughter at 8 years old, she's 22 now, so however long ago that was, woke up one day with this really different kind of personality going on, and this sudden onset, what we discovered to be a sudden onset OCD, form of OCD. And I didn't know what it was at first. I didn't know, like all of a sudden she was just intensely anxious and was asking questions over and over and over again for like hours, not like 3-4 times.
What kind of questions, if you don't mind sharing?
No, not at all. We had made Christmas cookies before, the kind that you roll in plastic wrap and put in the freezer to chill the dough and then you cut. And so she woke up the next morning saying, "Did I swallow plastic? Mommy, what if I swallowed plastic? Mommy, are you sure I didn't swallow plastic? Would I be dead by now if I swallowed plastic? What would happen when, is this?"
Yeah.
So that kind of fear around food, and then every kind of food thing that looked a little off, she thought might be poisoned, and became very terrified to eat, which is a problem. That gets, you little tiny girl, that gets bad real fast. And then
And it was really
spread.
sudden.
It was sudden. It was at the time, what they called a very controversial diagnosis, which is PANDAS, which is pediatric autoimmune neuropsychiatric disorder associated with strep. And there's PANS now that has been sort of broadened. So it's not just strep. We understand it's really any strong immune system reaction, but Lyme disease, things like that. And so she had strep throat and done the antibiotics and gotten better. And then her fever spiked one night and went away the next morning. So we didn't really do anything about that, and things progressed. And then about 6 weeks later, this happened.
Wow.
And I did a lot of research. I discovered this thing. People looked at me like I was some crazy lady with 3 heads. That's just like, that's not real. As I discovered, moving forward through the years, there's people have research squabbles, and sometimes things get dismissed because of reasons that aren't really valid. But it's a tricky one. There's a lot of people who still think it's rare, but I had that experience. She had all of the symptoms of, sudden onset, really severe OCD, often food related, lots of agitation and confusion, and it was terrifying.
Yeah, and regardless of what labels you want to apply to it, you had this version of your kid, and then you had this version of your kid, and that was a stark contrast.
Right. And as a therapist, of course, I thought I was supposed to know how to handle it and how to help her, and I felt like I was more equipped than most parents, but I was still very ill-equipped to handle OCD. And I discovered that, as you do when you are in the face of it, by doing a lot of research. I went to New York and did the International OCD Foundation's Behavioral Therapy Training Institute, teach me about this. And that began the shifting of my career into helping people with OCD and their families.
Wow.
Because, having lived it, I realized how, as a parent, our natural loving inclinations are actually the wrong way to interact with somebody with OCD. And so I found it fascinating. I thought the training was incredible. I learned CBT for the first time really in my career as a mental health professional, thought, okay, there's some stuff that's really useful here. And so then I took a job for a year in an OCD treatment center so that I could get some cases and really learn to apply it. And here I am, 15 years later.
So that probably appeals to that math side of your brain as well, the kind of more system, approach, and there's a way to do things that you can stick to.
Yeah, there's the manualized treatment plan, and it's interesting. As I'm talking to you, I'm even sort of seeing for myself how the route here kind of really informed what I ended up doing. But it's still an art, right? You may have session 1, session 2, do a hierarchy and these are your skills, but it's still in how you apply it and how you meet your client where they are. And so, yeah, it definitely, it's nice to have an evidence-based method, to use. And when you see somebody suffering the way my daughter was suffering, and you watch as they get better, she was in an intensive outpatient program, and she got better quickly. Like she was in so much distress. And in like 3 weeks' time, I could see a difference.
Wow.
So when you watch
how quickly did you get her in there?
It was like several months until she got in because there was a waiting list.
That's not years, though. That's great. I mean,
No,
some
it wasn't
people,
years.
that just flies under the radar for so long.
Oh, yeah. Well, that's the other thing. Yeah. People don't know. Yeah. We don't know what OCD is really. We know the sort of what shows up in TV shows, but it's complex and it shows up in a whole lot of different forms and shades of gray. It's definitely complex. So yeah, no, we were really fortunate. I identified it quickly, got her into treatment quickly, and it was the right treatment, right? So it was how you need to work with OCD to make an impact, because even I think 40 years ago, there was no cure theoretically for OCD. We didn't have treatments that really worked. And when you watch something like that work that dramatically, for me at least, it was like, I want to do that.
Yeah, absolutely.
That's what I want to do. And so, yeah.